All right. People are coming in, but we're gonna get started. My name is Ellen Baxt, and I work at the CUNY Central Office. I work especially with the case managers on all of the campuses. So I'm gonna share my screen now, and hopefully you will see it. Okay. Do you see something? Give me a thumbs up if you see something that says careers in healthcare. Great. Okay. So this presentation is on careers in healthcare. I chose this topic because I know that lots and lots of students have an interest in careers in healthcare, or you think you do. And so I wanted to give like a big overview of careers in healthcare. So, welcome. This session is already being recorded. Once we're done, it will be on the Google Classroom page that we have set up. That's where all of our presentations live, the recordings, as well as the slide presentation, which is what you see in front of you right now, as well as any resources. And so this is, I believe, our third in the series. The first one was on CUNY admissions. And the second was on post-secondary options, kind of figuring out what your interests are and post-secondary planning, meaning what you're going to do after you earn your diploma. If you can keep your video on, it really helps with kind of our like engagement with each other. If you are having your video off and like putting your kids to bed and making dinner, that's fine too. Write questions you have in the chat, but I want you to listen first and see if I'm already going to answer them, because I did look at the questions you submitted during your registration, and I have those in mind when I created the presentation, so I may already be answering them. You are muted now. There is going to be a time at the end that's just like an open forum for people to unmute themselves and ask questions and have conversations. So for now, if you have a question about something that I'm saying, you can write it in the chat, and then we'll unmute everybody later on. So today's session is, I see there are a few things in the chat, so I'm just going to kind of stop and look at that. Okay. I will share Google Classroom later on. So today's session is about the healthcare industry. So first off, I want to talk about what do we mean by that? When we say the healthcare industry, what does that mean? So I want you to write some responses in the chat. When we say the healthcare industry, what does that mean? We're talking about the healthcare industry. What does that mean? Anybody want to take a guess? Healthcare. So I see Ahmed says healthcare related jobs like doctors, nurses, or the instruments they use. Interesting. Medical fields. Mhm. So an industry is a group of related jobs, right? Like people are working in the same kind of area. So some jobs in healthcare are medical, and some careers in healthcare are not medical, right? But I think like our when we first are thinking about healthcare, like our mind goes to medical jobs. Working with patients, doctors, or equipment, counseling people, working with patients. So all of those things. So we're going to talk today about some careers working with forensics. I see that. Yep. Um, the sector that provides services to treat people, to treat patients. So we're going to be learning about some healthcare careers working with patients and some not working with patients because healthcare is incredibly vast. So let's see. Okay. So I think like a lot of us hear that the healthcare industry is booming, meaning that it's like really a hot industry. There are a lot of jobs in healthcare. Why do you think that is? So I want you to write in the chat, why do you think the healthcare industry is really growing a lot right now? There are a number of reasons. The pandemic, okay, so the pandemic, there's a lot of illness, right? Baby boomers are getting older. So people are living longer, right? People are living longer than they used to, and they need medical care. So that's a big reason. People are always sick, needing more and more hands. People have more health, there are more people with health insurance than there were previously, and so more people are accessing healthcare. Another person said baby boomers have grown old now, right? So like people are living into their 90s versus into their 70s, as they were a few decades ago. There are also like new procedures, new diagnoses, new medical equipment coming out all the time. And so those things are researched and produced and distributed and used. And so the industry is just like growing and growing and growing. Okay. So what I have here are some categories of types of careers in healthcare. So I think like in the middle you have clinical. That's I think the big one that people think about. Clinical is treating, providing treatments, right? Working with patients. So above that I have patient facing or public facing. So you're dealing with the public, you're dealing with patients. There are lots and lots of non-clinical jobs. So I saw in the chat that several of you were interested in healthcare information, billing and coding, careers like that. Those are not careers where you're treating patients. Those are careers where you're working with paperwork, right? You're working with codes and files and records. And so you're kind of behind the scenes supporting the work of people who treat patients. Technical. So there are tons of machines that are used in healthcare, right? X-ray machines, sonograms, EKG, all those things. And so there are lots of positions where people use those machines on patients, but they're not actually the ones who are analyzing the results and talking to the patient about the results. So the doctor would do that, but there's this whole kind of category of technical jobs of people who are using those machines and equipment. And so there's like a little bit of patient contact, but you're not treating the patient. You're using a diagnostic tool, something that's like trying to figure out what's going on in the patient. There are administrative positions. So hospitals have hundreds and hundreds of staff people, and those people have to be organized, right? So there's like a human resources staff, there's a director of the hospital, there's directors of different departments. And so there are administrative positions, just like there are in like really any mid to large sized business. There are administrative positions. And so if you're someone who likes doing office work, you might like doing office work in a healthcare setting, or you might like doing office work in a different kind of setting. Um, Let me see. Okay. And then there's operations. And so I've only been talking about hospitals, but there are lots of different kinds of facilities that healthcare workers work. And those facilities have to be maintained, right? And so there's the grounds, there's the, keeping things clean, there's the machines functioning, there's the systems in the building wide systems. And so the facility itself has a whole staff that tends to it, not just the patients. So those are a few categories of different kinds of careers. So you might be someone who's like really a people person. You might be like, oh yeah, I want a clinical position because I what is operations? Okay. So yeah, operations has to do with the facility, the actual building, the actual place. Um, so you might really be a people person. You might be like, I really want to work with patients, or you might be someone who's like, I'm not really a people person. I'm interested in healthcare, but I should really be working with papers, not with people, right? So it's really important to like know yourself and know your skills and know your interests to figure out where you fit. Okay, so where do people with healthcare jobs work? Hospitals, clinics and medical offices, mental health clinic or counseling centers, right? So there's physical health, there's also mental health. That is a huge industry as well, right? With lots of different careers within mental health. People work in ambulances. Eric said he might consider becoming a paramedic. So people work in ambulances, nursing homes, right? We were talking about the aging population. So there are tons and tons of facilities with people who are elderly, who are ill or recovering, or who are in like long term facilities for people with disabilities. Schools, right? You have school nurses, school medical staff, cruise ships, right? Like there are all kinds of places that you might not think about where medical staff work. Baseball games, pharmacies, health fairs. We're going to be talking about community healthcare workers today, labs. So when you get a blood draw, that that blood goes somewhere and somebody analyzes that. Airplanes, marathons, courtrooms, funeral homes. Okay, so there are tons of different kinds of environments. I think often we think about hospitals as the main environment, but it's important to think about working in other kinds of environments. Okay, let's see. Okay, so steps to working in healthcare. So first off, you want to think about what interests you about working in healthcare. I think a lot of times people go to the name of the career. I want to be a nurse, or I want to do medical coding. Um, but you really want to think about what is it that interests me about healthcare. And from there, you're going to go to number two, which careers will enable you to pursue your healthcare interests? So I'm going to say that again because it's really important. Instead of thinking about, I want to be a nurse, or you have this image, what is it about that career that's interesting to you? Because there may be several careers that fit that bill. And it may be that the one you're thinking about might not be the best fit for you. So you want to get really clear, what are my interests? In the past, I've shared my next move. Let's see. Do you see my next move in front of you? Or do you just see my presentation? Let's see. Thumbs up if you see my next move. Yeah, okay, because sometimes it gets funny. So if you are not sure about your interests, this is one great tool. It's mynextmove.org. And you can go here, and if you click start and you're in this purple area on the right, it asks you all these questions that can help you assess your own interests. You can also come here in this middle area where it says browse careers by industry, and you can say, oh, health. I wonder like what the different careers in health are. So if I click there, I click browse, it's going to list a whole long list of careers in healthcare. And you can just explore, right? So when I was reading this list, I was like, cytogenic technologist. I do not know what that is. And so you'll see it's highlighted purple because I was like, that's interesting. I have no idea what that is. What is it? And so I read about it and I found out that it is someone who works in a lab who analyzes chromosomes or chromosome segments. So this is someone who might work with people who are trying to become pregnant, or maybe people who are like trying to get a possible genetic condition diagnosed. Um, okay, so I see Eric put the link in the chat. It's mynextmove.org. And you can search in a few different ways. You can take this assessment that asks you a bunch of questions. Would you like putting together cabinets? Would you like working outdoors? Would you like working by yourself? And then at the end of it, it makes this list of careers that it recommends for you based on your responses. Or you can search the way I just did by searching the industry, right? So if I go back, so I found out all these things about cytogenic technologists that I did not know. And I actually like had an experience with someone who had this job, but I didn't know what the job was called. So you can get lost in here. You can learn about all kinds of things. And so it's in alphabetical order. You can just go down this list. Okay. The yellow sun means bright outlook, which means that there are a lot of jobs. Okay. Do you see my presentation again? Thumbs up if you see my presentation again. Yes. Okay. Thank you. Okay. So, what is your interest? And then which careers will enable you to pursue that interest in healthcare? So, next, what questions do you have about what it's like to work in those careers? Okay, so you can read about it in a place like My Next Move. There are a number of other ways you can find out also. So, My Next Move has like the official line on what is a cytogenic technologist. But there are lots of other ways, and I really believe very strongly in getting information from lots of different sources. So My Next Move is like the official source. I like also just talking to people. So one thing you could do if you are thinking about working in a hospital or a nursing home is you could become a volunteer. So you're in that environment and you're like really observing a lot. How does it feel to be there? How do I feel? What am I doing? How do I feel about the pace? Is it stressful to me? Is it exciting to me? You could find someone to shadow. That means that you could find someone who has the job and you could say, would you mind if I like came to work with you and kind of watched, observed what you did and kind of acted like your shadow, just really observing everything? Um, Interview someone with the job you think you want. So maybe they're like, no, you can't come to work with me. But we could have a conversation about my job. And so you can develop questions that you really want to have answered. And you can ask that person for 15 minutes of their time and ask them your questions. So those are all like totally viable, great ways of learning about careers. Of course, you're going to consider that this is just one person who's giving their input, but you can do this with lots of people because this has become like my career is learning about careers and giving that information to you. I ask people about their careers all the time. And it's become really fascinating. I had someone from the gas company come to my house and I asked him about my job. And I just like chat people up about their jobs because I think it's really interesting. And I especially think it's interesting to find out how they became prepared for their job. Did they go to college? Were they trained on the job? And so those are kinds of questions that it's really good to ask too. What credentials are required? So once you know, oh, okay, I like to work with patients. Oh, okay, I could be a phlebotomist. I talked to someone about what it's like to be a phlebotomist. Then you need to figure out, what do I need to do to become a phlebotomist? Do I need a degree? No, I do not need a degree to become a phlebotomist. Do I need a certificate? Probably. And so you're going to find that information. So you can find that information in My Next Move, but not My Next Move is really a generalization. One of the things that I like to do is I go to indeed.com. Maybe Eric could write it in the chat. It's indeed.com. And I don't have it linked here, but let me see if whoops. Oh, goodness. Hold on. Why won't it let me? Okay. So if you go to indeed.com, which you should see in a moment. Does everybody see thumbs up if you see indeed.com on your screen? Okay. So I'm going to put in phlebotomist and I put in New York and then I'm clicking search. So one thing you can find out is what credentials or what preparation are employers actually expecting? Because what you read in My Next Move is a generalization, right? They're saying out of thousands and thousands of positions, this is a generalization of what people are expecting. But that doesn't mean that right now, currently in New York City, this is what employers are expecting. So I like to look at actual job ads to see, okay, what are people actually expecting right now? So at Speedy Sticks in Brooklyn, New York, they are, let's see, urgently hiring. This one does not really seem to say what preparation they're expecting. So I'm going to keep going. Let's see if this one says. New York City Health and Hospitals. So those are public hospitals. Examples of tasks. Minimum qualifications. So this is what we want, this kind of a section. High school or equivalency. So you need a diploma. It says you need some satisfactory combination of education, training, and experience. Completion of the prescribed training program for phlebotomists. So this employer wants you to have been through a training program. And so I just go through a bunch. I just go through, okay, this is saying BLS certified, RN preferred. Okay, so this is like a very high-end position. RN is a pretty advanced position. So, so it's good to look at real job ads so that you can really see what is expected. Then you're going to research programs. So you find out, oh, okay, I need a phlebotomy training program. I'm going to go find one. You can look for programs in CUNY. You can look for programs in local community organizations. If you just Google the certificate, or if you Google phlebotomy training, you're gonna find where those training programs are. You want to consider the time, the amount of time it is, the location, right? Is it going to be convenient for you? And the cost. With something like phlebotomy, you want to be sure that the credential that you get, the certificate, is like real and good, right? And so it might say like exactly what the certificate is, and you want to Google that and see, like, does this seem official or does it seem like Miss Molly's School of Phlebotomy. And like they're going to give you some certificate that nobody in the labor market knows what that is. And they're going to say, I know it says phlebotomy on here, but Miss Molly doesn't, we don't know what that is. Right. And then you're going to apply and you want to be persistent in that process. So there might be many steps to the process, and you have to keep doing one after the other, after the other, after the other until you get to the point of getting to your first class. You're going to give them your information. It means you have to be accessible to them. You need to check your email if you give them your email address. You need to keep your phone on. You need to take calls. You need to check your messages. You need to call them back. And so, I think what I see with a lot of students is they maybe start applying and then they kind of like peter out, right? Because it takes a lot. You have to be really persistent. And so just keep taking the next step and the next step and the next step until you are sitting in the class. So those are the steps. Credentials. So I mentioned in the last slide, I mentioned credentials, right? A credential is the piece of paper, the proof that you went through a certain amount of training and that the teachers deemed you successful in the program, and that they're saying that you have the skills to do whatever the thing says that you can do. And so that's called a credential. So there are certificates to work in healthcare, and there are degrees. There are some industries where you do not need a certificate or a degree. If you want to work in a restaurant, you don't need a certificate or a degree. If you want to have an entry-level position in construction, you don't need a certificate or a degree, except for maybe an OSHA certificate. So there are lots of industries where you do not need a credential. You might need experience, and that might be even more important than a credential. Healthcare is not one of those industries. Healthcare is an industry where you really need to know what the credential is, and you need to go get the credential, and you need to make sure it's the right one. A lot of healthcare careers also, in addition to possibly a certificate or a degree, they might also require a license, a state license. Usually that certificate or degree program will talk about the licensing process if that is something that's required. That's also something you can see on Indeed.com. So if you're looking through the ads, it will say if they're looking for someone licensed, or if they're just looking for someone who has a certificate or a degree. So certificates, are generally found in community colleges, some private colleges, and community-based organizations. Some other places too, you might find them in private businesses, but those are kind of the main places, also in unions. Degrees are associate's degrees, that's the lowest level. Then moving up, bachelor's degrees, master's degrees, and professional degrees. Professional degrees are like an MD, medical doctor. That is an example of a professional degree. Degrees, an associate's degree takes most people at least 3 years to complete. I never talk in terms of a 2-year college or a 4-year college. I do not believe in that language because I know that, students in New York City and in lots of places have families you're taking care of, you have jobs you're doing, you have like all kinds of responsibilities, and it doesn't matter how long it takes you, right? Like what matters is that it fits in your life and it works for you. So people take different lengths of time to complete a program. Certificates may be like 1 year, 1.5 years, 6 months. And so another distinction between certificates and degree, well, a couple of things that I'll talk about. So one is when you get a certificate, you're getting preparation to do a pretty specific job. When you earn a degree, in addition to taking the classes that teach you how to do the job, you're also taking English classes, math classes, arts classes, humanities classes, because when an employer sees that you have a degree, they not only think that you are prepared to do the job that the degree helped prepare you for, but they also expect a certain level of education. So they're expecting that you are a pretty good writer, that you're a pretty good reader, that you know how to read you know how to read safety manuals, you know how to write an incident report, like all of these things because you are a college educated person. So that's one of the differences between certificates and degrees. I see a question. Tawana is asking, can you get an associate degree in 2 years? So it's certainly possible. It depends how many classes you take at once. It depends how many classes you pass at once. I am always a little bit nervous when adult literacy students who earn a diploma go on and want to take like 6 classes at once, because you don't want to like use your financial aid on a class you don't pass, have to retake it. So I am personally always advise people to kind of like go slowly at the beginning when you're first transitioning to credit classes to make sure that you pass them and that you do not have to repeat them. So, I mean, it's certainly possible. It's not really as common to complete a degree in 2 years. So I'm looking at the chat here. Gehad said bls.gov. So I'm also going to talk about that website. Is a good website to check the job outlook, requirements, and salary. I have that as a link in the last my last slide at the end. Okay. So one more distinction between certificates and degrees. Degrees, you can use financial aid. Certificates, you cannot. Okay. Degrees, you can use financial aid. Certificates, you cannot. You can for some certificates, only some certificates. There's something called ITGs, individual training grants. Individual training grants. Those you can find out from Workforce One centers. Maybe Eric could write some of this while I'm talking. Workforce One centers, ITG grants, individual training grants. This is something you have to apply for. And they are only for certain certificate programs. And so you have to see if the one that you're interested in is covered by an ITG grant, and then you have to apply, which I think you have to like write an essay or something. So again, those are available through the Workforce One centers. Okay. So a lot of people are interested in nursing. So I'm going to talk a little bit about nursing, and then I'm going to also talk about a bunch of other careers. Nursing, a degree is required. Degree is required. It is a patient-facing career. There are associates, bachelor's degrees, master's degrees, and doctorates. Just because associate's degrees exist does not mean that they are accepted everywhere as the acceptable amount of preparation. If you want to work in a hospital, you want to do some research about, will an associate's degree, and like that's your goal, will an associate's degree be sufficient, or does this hospital or does this employer, whatever the employer is, only accept a bachelor's degree or a master's degree? So going back to the credentials, what credentials are required? Nursing is a very physical job, right? Lifting patients, turning patients. The shifts are long. They're often 12-hour shifts. You want to think about what the work is. Would I like sticking a needle into people? Is that something that will bring me joy? That's something that nurses do. Will I enjoy doing a lot of math, a lot of thinking about like dosing and weights and measurements and sizes and things like that? Nurses often deal with people in pain who might be crying, yelling, getting angry, getting frustrated, annoying their like patient roommate. Like it's intense, right? It's very intense. When I talked about like, are you a people person? This is what I'm talking about. Like, are you someone who likes to work in a very emotionally and physically challenging environment? On the upside, it is stable work. It pays a good salary. It's hard to generalize, but 70,000 was kind of the middle of the pack of in terms of the salary range. A couple of things to keep in mind in general in healthcare. It is difficult to get hired with a criminal record. There are some industries that are welcoming to people with criminal backgrounds. Healthcare is difficult if you have a criminal record. There may be alcohol and drug testing regularly. So those are some things in general about the career. Nursing at CUNY. So nursing programs are at many CUNY colleges, associate's and bachelor's degree programs. The way it works is, in general, you start out as a liberal arts major. You take some classes that are called the preclinical sequence. If you pass those classes, then you take an exam, which is an admission into the nursing program. So if you're at a community college, in general, you declare your major at the very beginning. When you're starting, you declare your major, but you never declare nursing as your major because you have to be admitted into the nursing program after you do the preclinical sequence. In addition to that, there are what's called retention requirements, which means that you have to maintain very high grades or you cannot continue in the program. So there are a lot of people who start a nursing program and are not able to maintain the grades and are not able to continue in the program. For all of those reasons, it is considered the most challenging major at a lot of the community colleges. So that's a bit on nursing. I hear from a lot of students who are interested in nursing. And if you're one of those people, I recommend that you do a lot of research, both kind of like on the job as it relates to yourself. Like, do I want to stick people with injections? Do I want to deal with people cursing at me and crying? Like, think about your own, what's going to feel like a meaningful job to you. And now I'm going to present lots of other careers in healthcare because nursing is not the only one. I see a lot of things in the chat, so I'm going to look through this right now. Okay, so one question from Darla is keeping your credits if you are transferring from a community college to a four-year college. So one of the things that you want to look into around that is called an articulation agreement. Articulation agreement. That is an agreement between two institutions. Some of them are two CUNY colleges, and some of them may be outside of CUNY, which say, okay, if you earn, for example, I'm totally making this up. This is not real. It's just an example for my mind. If you earn an associate's degree in nursing from BMCC You can get all of those credits transferred if you're admitted to a bachelor's degree program in nursing at City College. So it's a specific agreement between two specific colleges in two specific degree programs. So it's something that you can find on the websites of the colleges if you explore those websites. This is a good question. Okay, from Dale. How many classes would you recommend for someone starting with the high school equivalency diploma? The minimum, I believe, to be considered a full-time student is 12 credits. I hear that a lot of times college advisors are pushing students to take 15 credits. That is not something I recommend. College is hard. College is really hard. And there's a ton of reading. There's a ton of writing, and you really want to make sure that you pass your classes. There are campus supports like tutoring to help you, but you just like want to start off with the minimum to be sure that you're going to pass those classes. The other thing is that the classes you take at the beginning are like, they're your foundation to do well in the upper level classes. So if you're like just speeding your way through English 101, it's gonna, and you're not really mastering those writing skills that you need for the upper level classes, it's going to be really hard to be successful in the upper level classes. So my advice is to like do the minimum in your first semester or two in college. That is my recommendation. Kitty, I will echo what Kitty is saying. Even the associate degree in nursing is challenging. The associate's degree in nursing is the most challenging major at the colleges. I do not know about every single major, but I feel like pretty secure in saying it is extremely challenging. Daylene says my family member is a nurse and does 12-hour shifts at night. To become a nurse, do we have to take a test or get licenses? Both, yes. So you do have to take a test to enter the nursing program. You have to take a test to complete the program, and you have to become licensed. So all of those are true, yes. Okay, lots of questions about other careers. I see lots of people are interested in sonogram, ultrasound technology. Okay, medical assistant, I think that is, or medical. Okay. So that's nursing. Moving on. Certified nursing assistant. Okay, you might know it as a CNA. Okay, so this is kind of an entry-level position in healthcare, doing patient care, clinical patient care. A certificate is required. A New York State license may be required. The pay is around $18 to $25 an hour. You may work in nursing homes, rehab centers, hospitals, a variety of settings. There are some things that you need to do before you would earn the CNA, which is 1, get your diploma, and 2, get a CPR credential. Most of the programs can be completed in 1 year. It's offered at many CUNY colleges, CNA, Certified Nursing Assistant. A lot of the programs are in the continuing education departments. Because it's a certificate, financial aid is not accepted. ITG grants are accepted. ITG grants are accepted in this field. And what is the job? So the job is kind of the non-medical aspect of being a nurse. So providing assistance to patients with daily activities, not medical. So those are like almost different ends of a spectrum, right? Like CNA is very entry level, nursing is not entry level. Like nursing is a very advanced position. What's happening? Okay, surgical technician. Actually, I want to go back for a second. So CNA and nursing, those are offered at many CUNY colleges. What I'm going to talk about next, surgical technician, is one of the medical training programs. This is a degree that is only offered at one CUNY college. So this one is only offered at Kingsborough. So I'm going to talk about some other medical training programs that are only offered at one CUNY college. So a surgical technician is someone who assists surgeons during surgeries. So I feel like this is like a thing that we see on TV a lot. I feel like they say like scalpel, please. Like the person, like that person who like organizes all the tools, cleans all the tools, cleans the patient, makes sure that the surgeon has like the exact thing that they need at the exact right time. That is a surgical tech. Okay, the salary is around 50,000. And again, that's kind of like the middle of what people earn. And I have a short video here on someone who started out in like operations. I think he talks about starting out maybe as a custodian, but he calls it something with a fancier name. And he becomes a surgical tech. And so I'm going to play that for you now. If the sound is good, just give me a thumbs up because I just want to be sure that you see it and you can hear it. Oh, sorry.
Ellen, I'm not seeing anything, or
Oh,
should we be?
hold on. Help. Okay, hold on. Sorry. Okay. Let me now reshare. Hold on a minute. Thank you for letting me know. Okay, now do you see YouTube? Yes? Okay. So let me just go back to the beginning.
Sorry, no sound.
Oh.
I think, are you sharing the sound? There's a little checkbox when you share.
Hold on, say that again.
When you share screen, there's a
Oh,
little.
okay. Hold
You
on.
click on
Share sound. Okay, third time's a charm. Let's see if this is going to work. Oh no. Okay, tell me if you hear this. Do you hear anything? Did you hear anything?
No, there's a little volume thing next to you. See that little volume bell next to the play button? And it's all the way up. Yeah, I'm not hearing anything. I don't see
Okay,
any other people on it either.
that's too bad. I don't know if it's worth just doing it with the closed captions. What do you think?
I can give it a shot.
Okay.
Determined once I had my mind focused, nothing can distract me. I'm open to learning new things. I'm willing to listen to anybody else. Common sense. I think being self-motivated helps me at my job because I'm going to keep working to perfect whatever I'm doing. Like if you give me a mission,
I could also share it myself if you like.
accomplish that. And I want to do whatever I'm doing better than anybody else has done before me. I started here at Hopkins when I was 19. I was a year removed from high school. I started out in environmental services. I worked there for 5.5 years before moving on to become a surgical tech in the OR. And I've been scrubbing now for 9 years. Now, in the beginning, when I first started, I used to go home at night and study everything. I wanted to perfect my craft. I wanted to make sure that I was not the weak link during the surgery. So I would study as soon as I left the building. I would read my textbooks and go online and look at the procedures.
Coming to the operating room, doing some of the intense or very delicate operations that we do in neurosurgery, Ed makes it easy. He knows his job, I know my job. When I come to the operating room in the morning, I see that Ed's going to be in my room. I just relax and I can focus.
Working with each other every day and doing the cases, same cases over and over for the past 9 years, I can pretty much anticipate every step that he's going to take during this procedure.
You know, he trained here. He knows the Hopkins system. It's familial. It's a family for him. It's easy.
I started working here when I was 19. Now I'm 30. I'll be 34 the 25th of May. So I pretty much have grown up already. I have like a long-standing relationship with a lot of the doctors around here because I met them early in their training, and now I watch them graduate. So it's like watching a child grow up. This position has opened up a lot of doors for me. I've seen a lot and I've done a lot, and I'm actually the one from my neighborhood who actually made it out. So like all of my friends, they took a different route. So whenever we see each other, they hold me with high praise. It's like I'm the golden child. I'm the one who actually made it out of the neighborhood. There's some good opportunities here. It's up to the individual to take advantage of them. Hopkins is what you make it. If you come in and you have limited education, okay, they got diploma programs. Then if you want to go to college and enter into some program, you can move forward with that after that. It's like you'll both benefit from it. Like they get another person at this position and you get a job. So it's like you're partners. It's very rewarding to go home and know that you help save a life or you help make a child's situation better. And this is every day. Like I don't take it for granted at all. I didn't know nothing about this when I was in environmental services. I said I was going to make this work no matter what it was. I could not pass up that opportunity. My name is Edward McKay Jr. I'm a surgical technician here at Johns Hopkins. I promise that you will get my undivided attention. There will be no distractions. I promise you the best health care when I'm in the room.
Okay, so I apologize. I guess you could not hear anything. Is that correct? Okay, well, so that is surgical tech. And that is, let me just share my screen again. That is an AAS degree in an Associates of Applied Science. I think that this is a great career that people don't really think about very much. I see there were many questions in the chat, so let me see. Okay, thank you all for telling me you could not hear. I apologize about that. Okay, so the next one is Respiratory Therapist. This is another program that only exists at one CUNY college, which is BMCC. It's an associate's degree. It requires state licensing. Respiration has to do with write it in the chat if you know. That's a good idea, Joan. I'm going to put the link. I'll put the link in the chat. The lungs, the breathing, right? Yes. So respiratory therapist is the person who helps with the breathing. The salary is around a minimum of 60,000. You're working in a fast-paced environment, right? Like you're dealing with emergencies where people have trouble breathing. And so this is another patient-facing position. It is, you know, a fast-paced, pretty intense position. There is a video, but I'm not going to show it to you because I know that you cannot hear the sound. At the end, I'll try to put the links to the videos in the chat. Okay, so another one.
Ellen, I'm sorry to interrupt, but we were actually able to hear the second half of the video for whatever reason.
Oh, should I go back and try the respiratory therapist?
Maybe it just took a minute. I don't know.
Oh.
Maybe you might try it.
Okay, let me try. Oh wait, hold on. Do you see anything now? Do you see?
If you've ever been to a hospital.
Do you see YouTube or no?
We see and hear both. Oh.
Oh, okay.
Sorry, yeah.
Okay, let me just go back. I'll just share again. Here we go.
Well, chances are you've been seen by a respiratory therapist, but what's the respiratory care program all about here at Carrington College? I'm Elizabeth. Today we're speaking with some students to find out what you'll learn here in the program.
A respiratory therapist does it all. They're the ones in the hospital who put oxygen on you. They give you a breathing treatment when you're having an asthma attack. They are the ones who run your life support in the ICU.
Well, we learn a lot about diseases, how they affect the body, particularly the lungs.
We start with the very basics from how the body works, from anatomy and physiology, the real simple stuff from cellular structure all the way up to organ systems.
We learn CPR, and then we applied it over here to the mannequins. We learn ABGs.
What does that mean?
We stick a needle in your artery, and then we draw blood to make sure all your oxygenation is correct.
If there is any complication to any organs, especially our lungs, it will affect every other part of our body.
At the first you look at it, it's complicated, but as soon as you come to the lab and you all just apply it to the mannequin, it's really easy.
The mannequins here are great. They are very high-end, heart sounds, breath sounds, bowel sounds, very lifelike. They can check carotid pulses, brachial, radial, everywhere they would in the hospital, and it's very realistic. So if they mess up in here, it's okay. They can say oops and uh-oh in the lab, not phrases we like them to use in the hospital.
We have learned about signs and symptoms of certain cardiopulmonary diseases, what it looks like when a patient is going into respiratory failure, and to be able to apply all that on these mannequins is very helpful.
My whole family's in medical. My sister-in-law has actually been a respiratory therapist for about 20 years. And before I came to school, I was an ENT.
It's a 2-year program. I finished about a year. So in about a year, I will graduate.
That's so exciting.
Well, again, I looked at a few different colleges, talked to a few people that had gone here before. They were all satisfied in their learning and the instructors. So I took a tour, and went ahead and signed up.
So you've already gotten to do some clinical work?
Well, we did.
Okay, so some of these videos are sort of like a commercial for the training program, but they're also useful. So that's respiratory therapist. Let me hold on a minute. Let me go back to share my presentation.
A quick question, maybe, Ellen.
Yeah.
How long for a course like that? Do you know how long a course like
So
that
that's
is?
an associate's degree. So, you know, I think it would probably be around 3 years.
Thank you.
And again, that's offered at BMCC, and no other CUNY colleges offer that. Okay, so you know, I chose surgical tech and respiratory therapist because there's something similar about them to nursing, which is that they are fast-paced positions. They have good salaries. Excuse me. They are working with patients. And so I'm going to present some positions that are different from that now, or some occupations, excuse me. So one is community health educator. So this is someone who is not working in a medical setting. They're not working with patients, but they're still working in healthcare. They're not generally working with people in crisis. Okay. So if you're like, I'm a people person, but it's too stressful. Like I don't want to work with people in crisis, but like I am personable. I do really like working with people, but I don't want to work with people in crisis. So community health educators work in a variety of settings with the public outside of medical facilities. They're the people who might be working at health fairs, schools, teaching about healthy practices, diet, hygiene, disease prevention, talking about health resources. So they're kind of doing outreach in the community around how to be healthy, different aspects of that. It is a really big advantage for community health educators to be multilingual and multicultural. A lot of times they're going into communities where people might not speak English, or they might not speak English as their first language. It's really helpful for community health educators to know the culture of the community that they're going to, so that they can kind of like relate the science to, you know, the cultural beliefs around certain ideas around hygiene, around eating, around you know, even things like death and birth and puberty and all kinds of things. They also analyze data about community health. So community health educators are thinking, okay, what are the health issues in this community? Is it asthma? Is it mold? Is it, you know, diabetes? Like, what are the issues? They're not medical providers. So I have a video here I'm about to show you. This program is offered at many CUNY colleges. It's a little confusing because it actually goes by a couple of different titles. So I saw health educator, I saw community health educator. I think there were a few others that I saw. And so that can make it a little bit tricky to find. So there's that. So I'm going to show you this video. When I saw this video, I realized that it was on a YouTube channel that had a lot of other career videos that seemed really good too. So the YouTube channel is called Connect Ed, and you'll see it here.
Intrigued by the way that everyone's mind works and how our different. I was intrigued by the way that everyone's mind works and how our different experiences in life really contribute to our personality and overall psychological development. My name is Mikkel, and I'm a health educator. There are many ways to become a health educator. The route that I took was studying psychology in undergrad, and at that time my focus was sexual health education. I did a lot of HIV testing and counseling, talking with people about sexual health risks, and that was the bulk of my career. I was working with young people who were in the juvenile justice system, talking about HIV as well as teen pregnancy prevention. That required me traveling around the city and talking to small groups of youth. I then relocated to the Bay Area and began working with homeless and marginally housed youth. I work at a university. The environment changes day to day. There's a lot to do when you talk about working with students. When you talk about health and wellness, there are people coming from many different walks of life. The collegiate experience looks different for everyone. Here, I talk with students a lot about stress management, and balancing health and wellness with the student life.
Well, I came in for a doctor's appointment and we were talking about how I haven't really been eating that well, just because I've been so busy.
I think health or public health can be really important subjects to take. Also psychology, which I took in high school, can really help you understand a little bit more about how the human brain works and how that impacts our behaviors, which is important when you realize that every person interprets their health differently. I love that every day is different and that I get to interact with so many different types of people. And the bonus for me is when people have a breakthrough health-wise. So when they can learn a new skill or find out about a new resource that can really help to improve their life and health, that is a great day for me.
So when I stopped this video, I saw, okay, this is this channel that has all of these other videos. And so if you click there, you can see that are all of these.
I had always drawn as a little kid. I drew on walls, and then I drew in class. And
So that's community health educator, which is at many CUNY campuses, going by a variety of names. Let me just share this again. And so again, this is a position working in healthcare, but it is not with patients. It's not really a high stress situation. It's not a time sensitive situation, but it is improving the health of individuals and the health of families and communities. Let me just dip into the chat for a minute. Okay, so I see one question. Do you need a degree or training to become an interpreter? Yes. CUNY does have a medical translation and interpretation programs. So that's something that you can check out. Okay, so Kate's question around, would you need to apply for the respiratory therapy program? I believe that nursing is the only program where you have to actually apply to be in the program. So I think that most of the other degree programs, you just declare the degree and just go through the degree program. Nursing is very particular in that way. Yeah, so respiratory therapy, I see a few people are interested in that, so you should definitely check it out. And so like once you find something that you're like, this seems interesting, do some research. And so look for YouTube videos, look for videos elsewhere, Google it, just like go to My Next Move, go to the Occupational Outlook Handbook, which I'll talk about later as a resource. you want to like really find out what you can. So I'm gonna move along. Okay, so this is what I was just showing you. This Connect Ed YouTube channel has all these resources. So this I just found today. And the way I found it was I went to YouTube and I put in community health educator career, and there were a few different videos. And for this presentation, I was like, okay, I want one that's not too long, that's very clear, that's not just like this informal person, that's like professional. And so when I found that one, then it took me to this whole channel of other videos about careers. So just kind of let yourself explore, let yourself like get lost in this universe. Because there's a lot there. I also have this note on the side. So career video YouTube search tip. So when you find a career that you want to see some videos on, if you go to YouTube, put in the name of the career. So in this case, I put in community health educator, and then I put in the word career. So I wrote community health educator career, and then this whole, a whole list of videos on that topic came up. Okay. Okay. So that concludes basically the formal presentation. I'm going to open it up to questions. I know a lot of people were interested in healthcare information technology, coding and billing, and things like that. There is a degree in healthcare information technology. I don't remember which CUNY college has it, but there is at least one. There are a lot of medical billing and coding programs. I have heard from people who know a lot about labor that medical billing and coding jobs are not as available as they used to be. So if that is something you're considering, one thing you can do is just go to Indeed.com and just look for jobs, see what they pay, see what the training is like, see how plentiful they are. I'm going to show you some other resources where you can find employment statistics. So that's like, are there lots of jobs? Are there going to be lots of jobs in this field in the future? So there's that. Before we go to the open forum, I actually want to show you a few things. So one is, I'm going to show you how to go to the CUNY website and look for degree programs. So I'm going to the main CUNY website, which is cuny.edu. I hover over academics, and then I scroll down to where it says academic programs. Here, I'm looking at undergraduate education, and I click on undergraduate program offerings. When I'm here, when I scroll down, I can search by college. So this will show me like what are all of the degree programs that Baruch, for example, offers. If I want to search which college has the major that I'm interested in, I click where it says degree program and I scroll down. Okay, so community health and community health education, right? Those are like two different ones. So, okay, I wonder which colleges have that one. Okay, BMCC and York. I might say, okay, community health. Who has that? A bunch of others. And for this search, I also looked at health, education, and promotion. That's at Lehman. Okay, so you can find which college has the major, and then you want to go to the actual college website And that's where you'll find the major and like real information about the major. So like, what exactly do you learn? How many classes is it? What are the classes? Are there any prerequisites? Can you declare the major right away, et cetera, et cetera. Okay, so this is at cuny.edu. Now this drop down menu right here is only for degree programs. It is not for certificate programs. Only for, you see where it says degree? So all these things listed here are degree programs. They are not certificate programs.
Ellen, can I ask a question?
Yes.
So does that, because Myrna was wondering if York has a certificate in CNA, Certified Nursing Assistant. But from what you're saying, I think that means that if I go here, there's no Certified Nursing Assistant in that list, correct?
Correct. So what you're going to see in this list, you're not going to see CNA in this list because it is a certificate program. So the sad news that is very annoying is that certificate programs are not on this list. And so when I want to find out which college has, which CUNY college has a certificate program, I go to Google and I put in the name of the certificate and then I write CUNY. Okay, so like right now, we'll do it. We'll go to Google and I'm gonna put in Certified Nursing Assistant and CUNY and just see what comes up. So it is very sad to me that there is no centralized way that I know of. Maybe someone else has found something that I don't know exists, but I have not found a way to find certificates that's like a centralized listing. So I see, okay, there's one at City College, there's one at Lehman, there's there's one at York, right? So I just look for it that way. It's really difficult. So the certificate programs are housed in the college in the continuing education department. And so if I want to see if one is at York, I will go to York and I can go, I'm going to look for the continuing education department. So let's see, I kind of bop around until I find the continuing education department. Could be under academics. Could be somewhere else. This is real time. Really, it is this difficult to find things on our websites. So I think I'm going to go to this search and I'm going to put in continuing education. And I see, okay, here it is. Continuing and Professional Education Center. And this is not a lot of information. So, yeah. So what I would do in this case is I would email them, since there's an email address here. And I would say, do you have a CNA program, Certified Nursing Assistant program? If you're looking for a degree, again, you can use this drop-down tool. If you're looking for a certificate program, it's trickier and you like have to sleuth it out and you really have to like be a detective, be a certificate detective because it's hard to find them. Okay. So, so I think that's everything. So what I want to do now is we're going to try this experiment. We're going to ask everyone, we're going to unmute everyone, which is like, it could be a lot of mayhem. So I'm going to ask you to Eric, how are we doing this? Are we unmuting everyone? No, we're allowing people to unmute themselves. Eric.
Correct.
Okay. So, if you have a question, you will have the opportunity to unmute yourself. If you do not have a question, we ask you to stay muted so we don't hear all of the background noise where you are. I'm going to ask you to wait for an opening in the conversation so we only have one person speaking at a time so we can hear. If there is no opening or if you're feeling shy, you can write your question in the chat. If you've already spoken, I'm going to ask you to give other people a turn so everyone gets to have a turn. And last time we did this, people had so much knowledge and information. I have never worked in healthcare. I know the information that I just presented because I did some research, but I'm not an expert in healthcare. I've never worked in healthcare. So it is entirely possible that some of you have more information than I do about some of these careers. So I invite you to share any personal information you have. So I see there are some things in the chat. Let me just. Okay, Eric sent me some questions from earlier. So, okay, great. So I see some questions about social work. Social work at the associate's level is often called human services. So at the community colleges, you should look for the human services degree. Social work positions do require a degree, usually a minimum of a bachelor's degree. If you want to become a licensed social worker, I believe you need a master's degree for that. In general, licensing of pretty much any kind in pretty much any field consists of a certain number of hours of coursework, so classes, passing a licensing exam, and a certain number of supervised work hours under the supervision of someone who's certified. So licensing usually has those three components: coursework, an exam, and supervised work. Let's see. Kitty is saying York has suspended its program. So I did not know that. Thank you for sharing that information. Hansi is asking, what do you know about RNFNA? I do not know what that is. So I do not know anything about that. Okay, so Kenya is asking, would you consider a certificate only in CUNYs or is any place okay? CUNY is a reputable institution. So there are some places out there that are not reputable institutions that are going to try and steal your money and not give you anything that's useful to you in getting a job. So CUNY, when CUNY takes your money, it's going to give you something good. That's my short answer to that question. CUNY doesn't have every single preparation program. So, okay, now I'm looking at these questions. Okay, so an associate's degree, the question is, how many credits do you need for an associate's degree? In general, it's around 60 credits. Most classes are around 3 to 4 credits.
I think it's 64, Ellen.
64?
Mm-hmm.
Oh, okay, thank you. 64. I stand corrected. Okay, so I think that's it. I think we will take questions now, and I'm gonna stop sharing, and I'm gonna ask you to unmute yourself and just kind of jump in and ask a question. And if you hear someone speaking, then be quiet and wait until you hear a break in the conversation.
What about radiology technician or ultrasound technician? Are there any other careers that I can do that is going to be associated with that is not too, I know it's going to be a time consuming to do careers like that?
I believe that CUNY does have some radiology and EKG. I'm not sure about ultrasound, but I'm pretty sure there are some radiology, which means x-rays, and EKG programs. So you could look that up.
Okay.
So Ellen, hi, this is Kate. I know that at Bronx Community, they offer the rad tech, and it was also one of the hardest programs to get in. It was up there with the nursing. It's competitive.
It's a degree program or a certificate?
It's a degree program.
Okay, so that is good information. Very competitive. Okay, competitive means, Kate, do you have to apply to get in, or how is it competitive?
You have to apply to get in.
Okay. So like nursing, Kate is saying like nursing, you have to apply to get in. I'm assuming there's like some preclinical sequence where you have to do really well in your classes in order to get in.
So Ellen, my question for the students who are interested in nursing and feel like they might have the time, but they might not be eligible for the program. Is there a path that they should take prior to? Is there a suggestion you have for a degrees track they could take until they try to get into the program? Or do you think that if they apply and they don't get in, they should shoot their shot somewhere else?
I mean, so for people who are interested in nursing, because it is so competitive, I strongly urge you to have a backup plan, right? Like, what are some other careers that you might be interested in? So you can like try at a number of institutions, but it's also like, it's a pretty brutal job. Like I think. So I really want everyone to consider what attracts me about nursing. Is it the money? Because if it is the money, there are other jobs that pay good money, right? Is it the stability? There are other jobs that are stable. Like you really going back to like my kind of earliest point about what is it about this career that interests you? Is it the money? Is it the stability? Is it the patient contact? Is it the sort of high adrenaline environment? Like, what is it exactly?
Hello, my name is Dala, and thank you for allowing us to learn about all those things. My question exactly is it possible for someone to go into nursing and then become an RN, let's say, and then change their path into becoming a physical therapist? Like, does this person has to go all the way back to the bottom, like take all the classes they need to become a physical therapist, or that person can use some credit for the nursing program and just go ahead?
So that's a complicated question. One thing that you can do is look into the requirements for both programs, because it may be that some of the like especially earlier classes required in, I just forget the two examples you said, physical therapy and
Physical therapist, yes.
And what was the other one?
It was nursing.
Nursing, okay. There may be some classes in common. And so if you're thinking, I'm not sure which one I want to do, you may want to start with those classes in common to kind of see how things go.
Okay, thank you.
Hi, please, my name is Hannah. I just wanted to ask a question about an entry of a college. Do you need to write an exams for the entry? And if yes, how do you prepare yourself for the test?
So CUNY mostly, maybe Eric can speak to this a little better than I can, or one of the program directors. CUNY mostly does not have entrance requirements, entrance exams anymore. And they use a combination of different various assessments to kind of see what level you would be placed at. Eric, do you want to bail me out? Or anyone who can speak to this a little better?
As far as entry exams, there's only four colleges that require entry exams. Hunter, Berkeley, Barch, that's what it's called,
Baruch.
Baruch, I'm so sorry. Baruch College, Hunter, I think Queensborough might, and one more, but it's only four colleges that, and they're all four-year colleges that require you to write an essay for entrance. No other college, all the other CUNY colleges does not require you to write an essay.
Queensborough is a 2-year school, and they
So
don't
it might not be Queensborough, it might be Lehman, Hunter.
It might be Queens College. It might be Queens College.
Or Queens College. But I know it's only four that require essay, and they're all four-year colleges that do.
Yeah, so the CUNY community colleges are open to anyone who pays their fee and has a diploma, which would be a high school diploma or a high school equivalency diploma. So at the community colleges, if you have a diploma and you pay your admission fee, you're in, as long as there's space. Then the question becomes, what level are you starting at? Do you need some support before you're ready for classes for credit? Or can you start immediately with your classes for credit?
Thank you.
Hi. What do you know what other careers we can find in a hospital or mental health clinics in the others than psychiatric and psychology?
So social work is one. Social work, mental health counselor. Those are a few that you could look into. You know, even in facilities like that, there may be positions like a dietitian or health educator. So you could think about those as well.
Hi, my name is Ahmed. I asked in the chat, but you didn't respond. For international students, usually what requirements CUNY might ask that I should be prepared for?
Kitty, do you have any information on that?
Well, I'm not quite sure because it's a very general question. I mean, are you coming in as a documented person, an undocumented person? Do you need financial aid?
No, I don't need financial aid mostly. I'm going in as documented person.
All right. Hold on, hold that question.
Okay, sure.
Okay, we'll
Take
do
your
that.
time. Sorry.
All right.
I can ask part of that question. And I'm an immigrant too, and I'm doing the translations of my certificates first. This is the first step. And I know that if you are in CUNY, they have some offices that they will do the equivalent of your certificate. If you are not in CUNY, you will have to look to go outside to do the equivalent of your certificate.
And
Thanks a lot.
where are you getting your certificates translated? Is that in CUNY or somewhere else?
No, somewhere else. The place is, I forgot the name, but Kitty sent me the information.
Oh, okay.
Oh, I sent it. That's Anna.
Okay.
Yes, you send me information and it's really helpful. Thank you.
Oh,
Thanks.
I sent it to her. All right, so wait a second. Let's go back to the foreign student, the
All right,
international student.
Yeah.
One of those places they call World Education Service. You
Oh,
can do
World Education Service.
Yes.
I'll put that in the chat.
Anymore.
Excuse me?
I said you don't need me anymore because you learned where you could go to get your degree translated. Is that what Ahmed wanted? To know where to get his degree translated?
Ahmed, did that answer your question?
Yeah, mostly.
Okay.
What stage are you on, Ahmed?
New York.
Diploma? No, I didn't mean what state. I meant what stage. Have you received a high school diploma in your country? Did you?
Yeah. I did actually Cambridge A levels, which is equivalent to high school diploma.
Okay, so for CUNY, you need a transcript of you have a copy of your diploma?
Yes.
And you have a transcript of your grades, like what each class meant.
Yeah, how much do yeah.
So once you get that translated, you can that can go to the admissions office.
Yeah, I put that in the admission office and then we start to, yeah, thanks.
Okay. All right.
All right, you don't need me.
No, don't say that. You were helpful too.
All right. Any other questions?
I have a question. Are they training programs or colleges for like a translator?
Yes. So I believe that there are medical translation programs in CUNY. There may be like general translation programs also. So that's something that you can look up on the CUNY website.
Okay. And
I have a question.
Sorry. Go ahead. I wanted to share something, but about since a medical topic. So my younger sister, she's a nurse, and it took her 15 months to become a nurse, and she did 4 years for her bachelor's, and then 4 years of her master's, in total 8 years to get to nursing. And her occupation was oncology, working with kids with cancer and leukemia. And then she moved on to neuro, which is the brain. So that's what she's doing now. She's working night shifts and day shifts. So depending on the days that they tell her what days she has to come in, that's when her shifts are. And it's very intense. She has told me it's very intense. She doesn't get enough sleep. She had to study a lot to get into nursing high grades. So it's a lot.
Yeah, it's really a lot. Did you say she had a bachelor's and a master's?
Yes, she had to do her bachelor's first. She went to the CUNY of City College. That's where she started. And then she wanted to like go to a different college because they didn't offer certain majors. So she had to go, she got accepted to Columbia for her master's.
And when she had the bachelor's, before she had the master's, was she working as a nurse with only the bachelor's degree?
She had to do within, I think, within the college, she had to do clinical rotations and programs. I think she did an internship program.
Mm-hmm. But she wasn't really like working full time until.
No, at the time she wasn't working full time. She would just do internship, and then they would let her know when she can really start working her way up.
Right. Thank you for sharing that.
And the pay is good. She doesn't make a lot of money. It was a high end stress job.
Yeah.
I have 2 questions.
Yeah, hold on one second. Just on the translation, a few years ago, I was also seeing a lot of need for translators in courts, in the courthouses. So that's just kind of a related thing with translation.
Because I'm a Spanish speaking person, so I translate all the time for my mom. So I notice I go to dentist appointments or like doctor's appointments. So sometimes they need me to translate for my mom if they don't have a translator on hand. So that's why I'm interested in translating.
Yeah. And there's also a big need for multilingual people in the medical field so that there isn't a need for translation, right? Because like if you think about the act of translation, having someone go between you and the doctor relaying very sensitive information, like that's a really difficult thing. I mean, it's so wonderful for patients to have a translator, and it's also terrible for patients to have a translator, right? And so if you're multilingual, it's really, really important that you see that as an asset. Like that is something you have that other people do not have in the labor market, and that you should always highlight that skill if you are multilingual, if you speak a language other than English.
Okay. Thank you.
Yeah.
Ellen,
Mhm.
thank you so much for helping us and being there and supporting you and Eric and other members. I have another question. If you're entry level, I was speaking about in reference to radiology and ultrasound technician, but as an entry level person going into the healthcare department, what kind of entry level jobs or certificates that I can inquire about? Because like some of the job ads I've been looking at, they seem pretty simple as far as computers and other office background that you need. But I'm also trying to find, I see at the end of it, they need some type of, I guess, medical terminology background information. I mean, education. So I'm just trying to figure out where can I work my way up. I'm trying to have an open mind that if I can't get the two major careers I'm looking for, if it's not right now, where can I start from the ground up and just start a basic job? Like what can I do?
So one of the kind of lowest entry level positions in healthcare is home health aide. It generally does not require a certificate. The pay is very low and the work is very hard. So, it's definitely, some people stay as home health aides for a very long time, and are happy doing that. It's really hard work for low pay. And so a lot of people start there, and then kind of work their way up by gaining, more credentials. Healthcare is really not an industry where you get promoted just by experience. Right? There are other fields, like you can do that in construction, you can do that in hospitality, you can do that in manufacturing. In healthcare, like you really need to gather those credentials. So some of the lower level credentials that you might want to think about are CNA, certified nursing assistant, LPN, licensed practical nurse, and CMA, certified medical assistant. So those are three kind of entry level. Some, a lot of medical assistant, positions are requiring a degree, but you will also see certificates for medical assistant. I would go to Indeed.com and see, if you look through those job ads for medical assistant, are employers tending to ask for a degree or a certificate?
Okay, thank you.
Yes, Sharika is saying phlebotomist. Yes, phlebotomist also is one, thank you, that you don't need to have a lot of training for. Phlebotomist.
Yeah. Thank you.
Yeah.
I have two questions. First question is if it's a website or someplace that we can do translating from different country, like the high school diploma. And my second question is if we can do it's in person the classes, or is you can do online.
So there are some online programs. It just kind of depends which one you're interested in. So that's the answer to the second one. The answer to the first, so one thing I'll say about that is if you're working with patients and you're training to do physical things with patients, I think it's very good to do that in person. So right now during the pandemic, like there is a lot of shifting to online work. I have seen advertised fully online nursing programs. I would personally not want a nurse who was trained only online and not on real humans. So it depends which program you're interested in. There's some that I think, something like healthcare information technology, billing and coding, you're not needing to like observe humans or interact with them. Like I think that would be fine online. I think things where it's a high touch situation. I would not recommend doing that fully online, though there may be like some online components. For translation, one of the places is World Education Service. I'll write that again in the chat. I wrote it a little bit earlier.
Yeah, I copy already.
Okay.
But thank you.
So that's a place that you can get documents translated. There's some other ones, but that's a good one.
Thank you.
I actually want to go back. I have like a few things to finish up with the presentation. So I guess it's just one actually. I want to make sure that, oops, hold on. I want to make sure you see this. I'm going to share my screen. Okay. So, keep researching careers, right? So I found all of this information out by researching it, and you should do that too, because you're the one who knows what you're looking for. So my next move, we looked at a little bit, that has career descriptions, like the ones we looked at of cytogenetic technologist. It has that interest assessment I was talking about, where you answer questions about your interests and it recommends careers. And it also has that search by the industry or the sector. So we clicked on healthcare and it had that big long list of degrees in healthcare or occupations in healthcare. Another thing I was going to say, just while I'm remembering it, is when you go to the CUNY website, that drop down menu of degrees, that's in alphabetical order. It's not arranged by industry. So that's why it's really important to do all of your research first before you go to the CUNY website on like what credential you think you need. Because when you go to the CUNY website, it's just an alphabetical order, right? So that means that like community health educator is going to be next to creative writing, which is going to be next to, I don't even know. So it's not by industry, it's alphabetical order, so you can't really use it for your personal exploration. You kind of have to go there once you already know what you're looking for. Another resource that someone mentioned is it's called the Occupational Outlook Handbook. I'll take us there briefly for a minute. So Eric, can you give me the thumbs up? Do you see occupational? Okay. Occupational Outlook Handbook. So it's similar to My Next Move. You can see careers and you can see descriptions of them. I think the descriptions are really great. I think they're like written very well. So this is a summary. So it's just, brief summaries of the different kinds of information. So you see the salary, what the training is like. And then if you click on each of these tabs, it gives you more in-depth information. This information comes out of the Bureau of Labor Statistics. So these are the people who gather data about employment. So that's a great one. And the last thing that I wanted to show you is called Career One Stop. And this is like a video library of careers. And they are very short videos that are, can you see the list of videos here? Yes. Thumbs up. Yes. Okay, cool. So you see the industries, and then you can like drop down to see the list of careers. And then when you click on one, it's great because they're all really short. The most of the videos are 1.5 minutes long. And so you just see them.
While the stars of popular media may get a lot of the recognition, their appearances are made possible and optimized by the work of broadcast and sound engineering technicians. They operate the
Okay, so they're all about 1.5 minutes long. And that's a great resource. And so those three sources, the My Next Move, Occupational Outlook Handbook, and Career One Stop videos, I think are really great sources of information. So we are almost out of time. We have about 5 minutes left. Any other questions?
I have a question. When you look under the CUNY website, what category will be under interpreter?
That's a good question. So, let's see. I have the CUNY page open here. Okay, so here's what we're gonna do. So, okay. So I'm thinking interpreter or translator. So let's see. And I'm not seeing it in alphabetical order here. I'm not seeing it under interpretation. So I'm going to look under translation. And I do not see it under translation. Then I'm thinking maybe language. So this is, you kind of have to think like, what are some other words that it could be under, right? Not seeing it there either. So it could be, legal translate. Okay, so this is legal translation. And legal interpretation. So translation and interpretation in legal settings, court kind of settings, legal translation in Spanish. So this makes me think, seeing legal translation, that maybe there's a medical translation. Okay, so now I'm going to go back, see, do I see medical? Let's see, medical. So I see medical coding. I don't really see anything.
So Ellen, when I search for this, I'm finding certificate programs. So I don't know if that's the issue.
For translation, yeah. I mean, it's possible that there may not be any degree programs. So generally speaking, I think the programs in translation are certificate programs. Usually the prerequisite is that you have to take some sort of language assessment, because it's a pretty short program, so they have to be sure that you are already fluent in the language before you start learning about translation. So Eric put a few of those programs in the chat.
Okay.
So those are some things you can check out.
All right. Thank you, Eric. And
I mean, another thing to think just about translation, like I was mentioning courtrooms, there are positions translating in schools and, working in the hospitality industry. So there are really so many options with translation.
Because right now I'm working on my GED and I know they need like a high school equivalency.
Yeah.
So I'm working on.
For not all, but for most certificate programs, you need a diploma.
Yeah.
One of the exceptions is home health aid. You generally do not need a diploma. I'm not sure about phlebotomist, but I know for most certificate programs, you do need a diploma.
Okay, thank you.
In that order for be a translator, do they need the TOEFL exam to approve
I'm not
you
sure. You'd have to research that. I'm not sure about that. I mean, I
Okay.
think a lot of programs probably have their own exam, and I'm not sure which ones they use.
Okay, thank you.
So we're winding down. Does anyone have any final questions? All right. We have a few more workshops coming up. So the next one is, I believe, next Wednesday. Is that right, Eric? Next Wednesday, right?
Sorry, I have one more question.
Okay.
Hold on, please. My question is, if I'm not sure, I know I want to be in the healthcare, but if I'm not sure what the career I want to do, what major do I have to do in college if I go to college? Because
So that's a good question. So a few careers a few majors you might want to think about if you want to go into healthcare, but you're not sure what area exactly. Shrika says, very good question. I agree. Very good question. So liberal arts is a great major if you're not sure what occupation you want to have. In liberal arts, you can take classes in lots of different areas. And so it really kind of lets you branch out. Some of the CUNY colleges have liberal arts with various concentrations. So it might be like liberal arts with a concentration in healthcare. So that's one option. Another option that I really recommend is doing a degree in biology. Because if you're working in healthcare, you need to know a lot about biology. And it kind of like more than healthcare, like you're doing science, you're doing the math and the science, some of which you're going to be doing in a career in healthcare. So biology is like a very strong way to go. The other thing is some of the certificate programs, not certificate programs, some degree programs, especially the AAS degree programs, have classes that are specific to that one career and they don't really apply to other careers. And so if you change your mind, if you want to switch majors or if you want to transfer, some of those classes are not going to transfer because the class that you took is like very narrowly focused and doesn't really apply to something else. But when you do a major like biology, pretty much all of your credits are going to transfer because it's broad enough that it's not like this one narrowly defined thing about how to find a vein and like stick a needle in there. But it's about like, what are the veins? What are the arteries? What are the systems in the body and how do they work? And so going more broad is good, especially if you think you want to go for a bachelor's degree.
Okay, thank you.
Yeah.
I have a question, please.
Yeah.
Ellen, you said before the credit for healthcare, it's 64, right?
Yes, that's what Kitty said. For associate's degrees,
Okay, associate, not to bachelor or master.
Correct. For just the associates.
So if I want to do like just program for healthcare, no, like I don't want master, I don't want bachelor, just like some of courses. Can I do that?
Is it like toward a particular occupation or you're not sure yet?
Yeah, actually.
Like you're not sure? I think I would do an associate's in biology. Like if you really feel sure that you want to go into healthcare, but you're not sure exactly which program, I would think either about doing liberal arts and taking a lot of science classes or doing biology.
Thank you.
All right. So we're gonna wind it down. This record.
Sorry, and that is 2 years or 4 years in the biology that I cannot pronounce.
I don't really speak in years. I just speak in credits. So it's probably going to be around 64 credits. Depends if you're going full-time or part-time. So yeah, it's 64 credits. Our next workshop is going to be about financial aid. Several of you had questions about financial aid. We are going to have our favorite expert from the CUNY Welcome Center, Charlotte Henson Butler, who's going to be talking about financial aid, what you can get, how to get it, the steps you have to go through, what the money can be used for, all of that. And so that's going to be next Wednesday, the 21st, from 6 to 8 p.m. Eric put the link to register in the chat. And this recording, my presentation with all of those links is going to be on our Google Classroom page. Eric, can you put the Google Classroom in the chat?
It is in there. I'll post it again.
Oh, okay. Thank you. And again, I want to say the only reason I know anything about healthcare is because I researched it, and you can too. Those are my final words.
I'd just like to say I really appreciate the people who have come back to session after session and contributing with your questions and sharing knowledge with each other and your own experiences and the information you already have. And it's great to see new people as well. So I hope you keep coming. We will continue to learn together. I feel like I'm learning a lot. I'm not an expert, but I'm happy to be here.
All right. Thank you, everyone.
Thank you, thank you, thank you, and thank you.
See you next Wednesday.
Thank you.
Okay.
Thank you, Ellen, for the invite. Thank you so
Have
much.
a good night, everyone. Thank
so much.
you.
Thank you
Come
for your
learn
advice.
about money next Wednesday.
Thank you.